of your skin!
This section will cover the sun and its effects on the skin. The sun and its ultraviolet rays have the greatest impact on how our skin ages. Approximately 80 to 85% of our aging is caused by the rays of the sun. As we age, the collagen and elastin fibers of the skin naturally weaken. This weakening happens at a much faster rate when the skin is frequently exposed to ultraviolet rays. The UV rays of the sun reach the skin in two different forms, as UVA and UVB rays. Each of the rays influences the skin at a different level. UVA rays, also called the aging rays, contribute to 90 to 95% of the sun's ultraviolet rays that reach the Earth's surface. These rays weaken the skin's collagen and elastin fibers, causing wrinkling and sagging in the tissues. UVB rays, also referred to as the burning rays, cause tanning of the skin by affecting the melanocytes, the cells of the epidermis that are responsible for producing melanin. Melanin is designed to help protect the skin from the sun's UV rays, but can be altered or destroyed when large, frequent doses of UV light are allowed to penetrate the skin. Although the UVB penetration is not as deep as UVA, these rays are equally damaging to the skin and can damage the eyes as well. On a positive note, UVB rays contribute to the body's synthesis of vitamin D and other important minerals.
Fun facts about skin cancer. To minimize the scar, keep wound moist, apply petroleum jelly, and cover with a bandage. The biggest risk factor for melanoma is sun exposure. Make sure to always get your yearly exam. The dermatologist will check inside your ears, your scalp, and between toes and fingernails, so make sure they're dead. Tint car windows to protect yourself behind the wheel. A common treatment option for early stage skin cancer is Mohs surgery. That's when the surgeon removes tumor layer by layer. Redheads are an increased risk for melanoma because they are fair-skinned. Most common precancerous condition that could be skin cancer is actinic keratosis. Remember the ABCDE guide for moles: asymmetry, border irregularity, color, diameter, evolution, which would be change in size, shape, color, and symptoms. Celebrities also have had skin cancer too, such as Hugh Jackman, Diane Keaton, James Rebhorn, Michelle Monaghan, Anderson Cooper, Melanie Griffin, Brooke Shields, Sybil Shepherd.
The most common of all cancers. More than 3.5 million cases of basal and squamous cell skin cancer are diagnosed in this country each year. Most basal and squamous cell cancers develop on sun-exposed areas of the skin, like the face, ear, neck, lips, and the backs of the hands. Basal cells or squamous cells cancers can be cured if found and treated early when they are small and have not spread. The best ways to lower the risk of skin cancer are to avoid long exposure to intense sunlight and practice sun safety.
Prevention Guideline. Since its inception in 1979, the Skin Cancer Foundation has always recommended using a sunscreen with an SPF 15 or higher as one important part of the complete sun protection regime. Sunscreen alone is not enough. However, here are some lists of things that you can do to prevent. Seek the shade, especially between 10 a.m. and 4 p.m. Do not burn. Avoid tanning and UV tanning booths. Cover up with clothing, including a broad brim hat and or UV blocking sunglasses. Use a broad spectrum sunscreen with an SPF of 15 or higher every day. For extended outdoor activity, use a water-resistant sunscreen with an SPF of 30 or higher. Apply 1 ounce to 2 teaspoons of sunscreen to your entire body 30 minutes before going outside. Reapply every 2 hours or immediately after swimming or excessive sweating. For your newborns or children, keep them out of the sun. Sunscreens should be used on babies over the age of 6 months. Examine your skin head to toe every month.
What am I looking for during these self-exams?
You're going to follow the ABCDs. A is for symmetry. You draw an imaginary line through your mole. Do both sides look alike? If not, see your doctor. B is for border. Look at the outside edge of your mole. Are its edges sharp and easy to distinguish from surrounding skin? If the edges look ragged or fuzzy, see your doctor. C is for color. Check the color of your mole. It is the same throughout, or does it vary with shades of dark brown, black, white, red, or blue? If it isn't the same color throughout, see your doctor. D is for difference. Have your moles change in size, shape, or color? Are they suddenly itchy? Most moles on a person's body share a common look. Did you find one that looks different than the others? Do you have a new changing mole or suspicious looking patch of skin? Anytime you notice a difference in moles or on other parts of your skin, see your doctor.
Can I get skin cancer on parts of my body that aren't exposed to the sun?
Yes, although we often don't think of skin cancer as an organ in the same way as we would the heart or liver, it's actually the body's largest organ. That's why it's very important to check every inch of your skin, even in the genital region, underneath the breastline and between your toes.
Save your skin!